It's kind of like giving antibiotics for sexually transmitted infections instead of like using a condom, to use a bad analogy.
Field hospital. The words may have you thinking of some far-off battlefield, but they're being built in response to COVID-19 and could look like this one here at the Peter Lougheed Centre in Calgary. There are indications the province of Alberta is planning to build more with the help of the Army, drawing mixed reactions from those on the front lines.
The idea of bringing in more tents demonstrates a lot of forward thinking and preparedness.
While they may have worked on a small scale to this point,
when we're having trouble getting patients admitted upstairs into the hospital because there's a limit on the number of available beds, they often stay in that unit.
Others argue
it's kind of putting the cart before the horse, right? Like, let's stop the increase in cases. Let's stop the hospitalizations, the ICU admissions by actually putting in preventive policy.
It's not just about space. Vipont explains every COVID patient requires a nurse as well as respiratory therapists and intensive care physicians.
I don't understand how the military are going to provide those. Generally, military physicians, there's probably a very, very small number of their staffing that would be qualified to run these type of facilities.
We've seen them in Europe and the U.S., with New York Governor Andrew Cuomo urging hospitals to build more if necessary.
Currently, the rate of hospitalization in the U.S., which is arguably just a disaster when it's coming to COVID, is 300 admissions per 1 million population. We're well below that. We're closer to 100 admissions per 1 million population.
But some still wonder,
why are we planning for field hospitals when we don't have a national COVID app, we don't have a mask mandate, we don't have the sane restrictions that every other jurisdiction has been willing to put in place, except for those libertarian regimes that are similar to our own.
In Calgary, Jonathan Muma, City News.